Today, we're talking about a condition known as elephantiasis, a term that may conjure images that are both disturbing and intriguing. Elephantiasis refers to a severe swelling of body parts, most commonly the legs and genitals, and is often linked to a parasitic infection. The most common cause of elephantiasis is lymphatic filariasis, which is caused by microscopic worms called filarial worms. These worms are transmitted to humans through the bites of infected mosquitoes. When these worms enter the body, they can reside in the lymphatic system, which is a vital part of our immune system and fluid balance. Over time, these parasites cause blockages in the lymphatic vessels, leading to the accumulation of lymph fluid in the tissues. This lymphatic dysfunction results in the characteristic swelling associated with elephantiasis, giving affected limbs a thick, coarse appearance reminiscent of an elephant's skin. While elephantiasis itself is not contagious, the parasitic infection that causes it can be spread through mosquito bites. Filarial worms can lead to lifelong disabilities, affecting both the physical and psychological well-being of individuals, as well as their social and economic status. Symptoms can take years to manifest after the initial infection, making it a challenging condition to diagnose early. You might wonder about the prevalence of elephantiasis. The condition is most common in tropical and subtropical regions, with the World Health Organization estimating that over 120 million people are infected globally. Regions particularly affected include parts of Africa, Southeast Asia, the Pacific Islands, and the Americas. However, it's worth noting that while elephantiasis is most often associated with lymphatic filariasis, other conditions such as chronic dermatolymphangioadenitis and non-parasitic diseases can also cause similar symptoms, leading to confusion in diagnosis. Treatment for elephantiasis typically focuses on managing the condition and its symptoms rather than curing it, especially if the disease has progressed significantly. Medication aimed at killing the filarial worms, such as ivermectin and diethylcarbamazine, is often used, but the success largely depends on the timing of the treatment. Early treatment of the infection can lead to significant improvements and may slow down the progression of symptoms. In addition to medication, managing swelling through limb elevation, exercise, skincare, and using compression garments are essential components of treatment. Regular cleaning and care of the affected areas can help prevent secondary infections, which can further complicate the individual's health and reduce their quality of life. Preventive measures are crucial in areas where the disease is endemic. These measures primarily include mosquito control strategies such as using insecticide-treated bed nets, removing standing water to diminish mosquito breeding sites, and community health education to raise awareness about the disease. Mass drug administration campaigns in high-risk areas can also help reduce the incidence of lymphatic filariasis and subsequently, elephantiasis. Living with elephantiasis can not only be physically challenging but can also lead to social stigma and isolation. Many individuals affected by this condition face discrimination, which can exacerbate their psychological distress. Support from healthcare professionals, psychological counseling, and community support systems play significant roles in improving the quality of life for those affected. It's crucial for us to advocate for those living with elephantiasis and to push for better access to treatments and preventive measures globally. Research is ongoing to develop new therapies and vaccines that can help eradicate the filarial worms and reduce the burden of elephantiasis. In conclusion, elephantiasis is a significant health concern that highlights the intersection of infectious disease, public health, and social issues. Understanding the causes, symptoms, and treatment options is crucial for raising awareness and combating the stigma associated with this condition. If you found this information helpful, please consider sharing this video to spread awareness about elephantiasis and its impacts on those affected. Thank you for watching, and stay informed.